Welcome back. Yesterday, Nigeria celebrated its Democracy Day. 26 years later, it is essential to reflect not only on political milestones but also on the foundations that truly sustain a thriving democracy: health, education, justice, and equal opportunity. Our health system in particular plays a critical role in empowering citizens, reducing inequality, and fostering national development. Nigeria's journey toward a robust democracy is intertwined with efforts to improve healthcare access and quality, especially for women and rural communities who often bear the brunt of systemic gaps. One inspiring example of dedication and service in this sphere is Dr. Talemo Da. As a distinguished clinician and health advocate, Dr. Da has devoted his career to advancing reproductive health, improving healthcare access in underserved areas, and influencing health policies that impact millions. His work exemplifies a vital role of committed individuals in strengthening Nigeria's democracy through service and innovation. And today, we will explore the intersections of democracy and health, discussing challenges, opportunities, and the vital contributions of healthcare professionals like Dr. Da in shaping my future. It's so good to have you in the studio, Dr. Da. Welcome.
Thank you.
Welcome to the show, sir.
It's my pleasure.
All right.
Yeah.
Okay, doctor. So your career spans clinical work,
Yes.
healthcare services development,
Yes.
and policy influence.
Yes.
So can you share what motivated you to focus specifically on women's health and reproductive services?
You know, growing up, you have your fantasies about the things you want to do. Often, maybe I've had those fantasies. I wanted to be a physicist, work at NASA,
Okay.
and wanted at some point to be a pilot or something. But I found myself reading medicine. And when I finished, I thought to do maybe general practice or so, but I found myself specializing in obstetrics and gynecology. And I don't think there is a special thing that motivated me, but I wanted the kind of medicine that is holistic. So I would have done been a general practitioner,
Okay.
but I think there is a bit of general practice in the practice of obstetrics and gynecology, in the sense that you take care of a whole human being, whether the person has a medical disease, you see, whether the person has a surgical disease, you do, and you also take care of children, at least the ones inside the womb and the ones that were immediately born. So that kind of a general practice, so to say. So I enjoy that more holistic view. I think that may be part of the driving force.
All right, sir.
Yeah.
That's a good driving force, sir. Chinatu, you want to take the next?
Yes,
Yeah.
please. So I understand that you, through your work with the Sutere Afrik Rural Health Initiative, you reach underserved communities in a lot of ways.
Yeah.
In your view, from your whole experience, what do you think are the current obstacles facing that region, and how do you think we can address it in Nigeria?
You know, the problem with the underserved communities are complex.
Okay.
The truth is that because the country is overwhelmed, it is difficult to really remember them completely and honestly speaking. And where you see infrastructure, it is not easy to put infrastructures in those places because you need to maintain them. So there are no infrastructures. Number two, some of the underserved communities, even when you put infrastructures, either people vandalize them or they are destroyed either by bandits or whoever. And then the health staff, the health workforce, you won't find them there. Either because the distribution doesn't favor them, favor health staff going to the villages. Why will you go to villages? I mean, people are moving to the Western countries.
Sure.
Why will you now move back to the village? The other reason is that if you move to the village, you are in danger. You can easily be killed. You are a target to be kidnapped because those guys will want you to help them out in where they are, or you are in the village, you are a better target to be kidnapped for ransom. And so health, the personnel do not go there. And then the various things, health is becoming a very difficult thing. So the various new technologies that are supposed to be there, they can't be there. They can't be taken to the villages. They're not even enough for the cities. And if they are taken to the villages, no villager will afford them. So they don't get it. So the problems of the villagers is complex and very difficult and pathetic. I think those are the challenges they have. Yeah.
So how do you manage all of these challenges? Because we know there are a lot of limitations,
Yeah.
Yeah.
you know, practicing in the rural areas.
Yes. So when you go to the village, you discover that the disease burden is heavy. When you see one person, he has 3, 4 ailments.
Yeah.
Maybe he has diabetes, he has hypertension, then he has malaria or pneumonia, or he has a hernia, or one thing or the other. So the disease burden is heavy. Everybody just manages, go to the patent medicine dealer and buy some stuff to keep going at least. But when what we're doing is a kind of an innovation, because it is not possible for someone in the village to find somebody at my level of medical care to take care of the person, because I'm in the city. And even when you do come to the city, you meet several cadres before you reach my level.
Yeah.
But it's innovative in the sense that I gather people of like minds, people at my level, and carry them down to the village, right to the doorsteps. So that eliminates the financial constraints of the villagers. And because I'm going there, knowing that I'm in the village, I make sure I go complete. That eliminates the issue of new technologies. I take everything I need down with me to the village and to do it there. That eliminates lack of expertise because I'm there. That eliminates the fear that the villager has when it comes to facilities in the city, because now we've come down to them. We've done groundwork. You've gone to their chiefs. They've spoken to them. They know that these guys are friendly, so they will easily come. So in that way, you kill all the fears that they do have. And if I go to do surgeries in the village, there is first of all some trepidation. Should we not? When one person submits himself and they discover that it's successful, everybody now comes. Or they say they say, I don't mind them. This is the way they come and they don't help. They now discover that one person is going home with a bag of medicine. You know, so like one old man say, you mean all these things for me for free? And then someone sees it and comes. There is now trust. And if you go twice within a particular region, everybody hears about it. So the next time you're going, they even those who are not in that particular town will want to go there. So the fact that you have submitted yourself and you go to acts together with the villagers, soften the ground first. I write like a dozen letters.
Okay.
And I see quite a dozen people. I may write the Commissioner of Health, the Health Management Board, if I'm using the General Hospital. I write the DPO, I see him. The DSS, I see them. The Paramount Ruler, I see him. The Village Head, I see them. The youth leaders, the vigilantes, I see all of them personally. I walk there, I go and see them. Maybe a week, 2 weeks before time, then arrange hotels and caterers from that village. So by the time I come, it is our outreach, not my outreach.
Okay.
And so you see, the villagers are encouraged. They are encouraged through the churches, through the mosques, and through the traditional rulers, through that hierarchy. They call the people, inform them. Sometimes they announce with their local means of announcement, maybe a gong, town crier. So when I go, all those barriers are broken. It is now our outreach, not my outreach.
So you've used, with all of this that you've said, you've managed to handle the insecurities that might come with going to the rural area by writing to all those people.
All of them.
And I think even language barrier too.
Yes. The language barrier is broken because I will have gotten recruited interpreters even from that village. And the vigilantes are there. Even in the hotels, I could get vigilantes to sleep with my volunteers. In the same hotel, they guard the hotels, they guard us where we are working. And we've never been attacked. See, if they know we are there, even those people who cause security problems, they would like to come and get health care.
True.
They do come.
Yeah, sure.
So
I mean, everybody needs proper health care.
We really are not scared of those security issues.
All right, so how do you manage with electricity? Because I know that most rural area, they might not have lights.
Yes.
Do you also go with like generators, or do they?
When I'm going, my assumption is that there is nothing there.
Okay.
Absolutely.
That's
Even
better.
if there is a semblance of something there. If I'm going, it depends on the scope and the scale of what I'm doing.
Okay.
If I'm going to a Gwari village here, I know there's nothing. Absolutely nothing there. I can carry my generator along, and then an electrician who can make sure it gives us light and so on and so forth. If I'm going to a suburban area where I'll use a general hospital for a very large, because if I carry out a large outreach, I may reach 10,000 people in 5 days, because I have like 20 doctors seeing people from outside. So I get to the hospital, and we spend some money in the hospital. Sometimes they are big generator, they will tell me that they need a battery, they need it to be serviced. I make sure that is done. I have to buy a drum of diesel and keep there for a start. Okay. And then I make sure all the light points are repaired, and if the tap is not running, I make sure I repair them. So when I come, it can be smooth. But in the very small villages, and even in those places, for instance, to operate, I use headlamps. Okay. And we tie headlamps like those ones that miners use. So you have it on the head and you're operating, you got in your light.
Okay.
Some other places where we use light is in sterilizing equipment. And I sterilize enough of things like gauze and things we use, more than enough that I will need and carry. And I use other means of sterilization. Yet I carry a sterilizer that maybe uses gas instead of electricity. Right. And other places that must need electricity, we use battery, or actually we carry a generator or loan a generator to power that very segment. For instance, we may need it in the fridge. One place I went, on my visit, I discovered that most of the patients were snake bite cases. Mm-hmm. So I bought more snake bite medicines, but they need to be refrigerated. So you see, I think that was funny, because we'll be sleeping, but we have to on the car and plug in a small refrigerator that keeps the medicines going. And when there is light brought to that small hotel, we now bring them out, keep there. And that's how we're doing. So I make sure I go around every problem. The assumption is that, hey, there is nothing you will find there. So prepare absolutely, completely, properly.
For everything. Even emergencies, like where they need blood?
No. You don't assume.
Okay.
I go, of course, there is a lab scientist,
okay,
and I get all the blood bags, and I get all the antiserum, and I get all the things that are needed for blood.
All right.
I have tried getting the National Blood Transfusion Service to give me blood to transfer, but the logistics are difficult. So I just say, if you need to get surgery, you get someone to donate for you, since I can't buy it. But I have every other thing else to do with that.
That's fine.
Yeah.
I think it's very fascinating how you're able to weather all of these challenges in a very innovative manner. So we must laud you for that.
Thank you very much.
You and your team are doing amazing. I was going to ask if you're focused on a particular rural area, but from the explanation now I see that it's not limited to a particular place. So you go to different places in Nigeria.
My organization's name is Soteria Afrique.
Yeah.
Rural Healthcare Initiative.
Exactly.
It was meant to be Soteria Africa, but the CAC said they can't register. It sounds so formal, like a government thing.
Okay.
But when I tweaked it with the French and made it Soteria Afrique, they accepted. So actually, my place is not just Nigeria, it's Africa.
Okay.
I go everywhere in Nigeria, every suburban place and village, and everywhere in Africa.
This is very fascinating, especially seeing the kind of brain drain. In recent time, we've been seeing a lot of medical practitioners, leaving Nigeria, going out of Nigeria. But you decided to stay. And it's pertinent that we find out what exactly is that drive, what's keeping you, why are people leaving and you decide, no, I must stay and serve. There must be something driving that. mind sharing?
I used to dislike being a second-class citizen.
Okay.
And even though there are times in Nigeria I felt I was second-class, but I dislike being a second-class citizen. I don't quite love to be a second-class citizen. The second thing is that I think I've grown up to be very patriotic, thanks to my maybe principal in secondary school and so on.
Okay.
And we discover that you cannot develop a nation by allowing other people to come do it. You have to do it yourself. And what makes development sensible is that you do just your bit, just your little bit, just your little bit. And everybody does his little bit, and it will go around. So the craze to go abroad, well, I've tested working outside a little, but I opted that I should come back to Nigeria and stay. Even though a few times I'd regretted, why did you come back? But I think now I'm not regretting, because if we are making a little impact, it makes sense. And that is in nation development, everybody has to, do his bit.
All right.
Yeah.
So what you're doing is obviously a huge one, going to rural areas to provide them with health care. Do you get support, let's say from the government? Or are there like NGOs that support this initiative?
Especially seeing that most of the things you do are free. It's not easy.
No. It's got to be free. The moment you introduce any fee in the things you are doing, then it's not free again. And so there are fraudsters who come and say, we're doing an outreach. People gather and say, hey, you guys registered 3,000. And you can imagine if I see 1,000 people, I see 10,000 people in 5 weeks, for instance, in my mega ones, and they registered 3,000. I already garnered my, how much? A lot of money, isn't it?
Yes.
But no, let it be completely free. And about funding, my concept from the beginning was different. My concept was that if you look at Maslow's hierarchy of needs, you find that there are physiological needs at the background, and that is a lot of the rural communities and the poor.
Okay.
If you go to the top, you find that their needs is self-actualization. For instance, I want to win election. I want them to hail me. I want them to give me a good name. I want to give a befitting burial to my mother. That is what the big people want. Now, I noticed that I can solve the problem of the poor by solving the problems of the rich. Yes, because some people will tell me that, doctor, thank you for that, because instead of throwing a big party for my mother's memorial, come and do free medical for them. It is done in the name of his mother, and he knows he has honored his mother, because that is self-actualization.
True.
He wants to win election. My senator won election. He told me he didn't campaign. He didn't put a single poster. But because he did, he used me to do all these medical outreaches. The villagers just told him, don't even come for campaign. And he won landslide. You see, somebody may want to thank God. Somebody may just want to have a good name.
Yeah.
So most of the funding I got it within. In the small ones I do within Abuja, I use my personal resources. But in the big ones, I get the fundings from within Nigeria because it is there. Some of the fundings is from my friends, whom I'm twist and get something to do, something. So if you look at it, you can use the problem of the poor, the problem of the rich to solve the problem of the poor. The rich is happy because the poor are hailing him, because they're going to vote him, because they're going to thank God on his behalf. That kind of thing.
That's such a strategy.
So
beautiful one.
That was the original thing, because I knew that there are complexities in accessing funds from outside or from big donors. I still think accessing funds from big donors will expand it. The other thing is, part of the reason for my formation of the organization is I noticed that every NGO wants to have SMART objectives. SMART objectives means if you want to work on nutrition, they'll tell you it's too broad. Pick something small. Then maybe you pick macronutrients. They say macronutrients are too many. Why don't you pick folic acid? Then you work with folic acid. Or you want to work on health. They say, no, it's too big. Work on malaria. Malaria is too big. Take behavioral change. So you don't take behavioral change or take mosquito net and be distributing. That way, before you reduce the disease burden of any community, you have 1,000 NGOs working at the same time in a village. Why don't I go in an African way? If I go to a village, I'm going with every expert. I'm going with somebody who counsels them. I'm checking the HIV. There's an optometrist checking their eyes. There's an ophthalmology operating their cataracts. And there are surgeons fixing their hernias, and gynecologists doing the fibroids and the prolapses. And there are family planning people. Dentists is doing his own, all at the same time. Why don't we approach it like that in a massive way to reduce disease burden? Honestly, that's what makes ours an innovation.
All right.
Yeah.
I guess that is why you've been able to, you know, do lots of policy changes through the right things you've done with organizations, with the Ministry of Health. That's why you've been able to, you know, fill that gap, right? So my next question to you would be, we just marked Democracy Day yesterday. Now, we have many health professionals. Some have lost hope in the country. Some are just saying, I'm doing this for doing sake. The mind is not there. The other day, I saw a video where there was an emergency case, and when the vehicle came to the facility, the medical personnel on duty were just looking and tired and saying, I can't touch the body, I can't touch the person. And you can just tell, what is that? Is it that there's no more passion? Are they tired of the job? Against that background, what role do you think that our health professionals have to play in ensuring that this democracy we say we are practicing, it's really a democracy?
You see, the rot in the health system is just a reflection in the rot in every other system. It is the same Nigerians.
True.
They are, like you said, are they tired? Are they discouraged? They are tired, they are discouraged, they are feeling bad, and all of these things, all are working against them at the same time. Just like if you go to anywhere, you get the same kind of treatment that you are not happy. The health one becomes louder because it has to do with people's lives. But it is same everywhere.
True.
Having said that, if you look at the health situation, what they are paid and what situation they are in, for instance, and what covers everything, you really will not help. There was a time I was driving across the road. I saw people gathered on the other side. So I went and turned. And I saw that it was an accident. I said, quick, put them in my car. Who saw what happened? You come with me. And the boy who came with me was asking me, what made you pick them? I saw you pass the other side. And people we've been begging people, they refuse. I said, don't worry, you will understand. So when we went, the people, they were about to change. Those who are there said, their time, they can't carry a new case now. They're tired. Those who are just coming, they said they're just coming. They're not even, how would they? Then he was trying to get angry. I said, don't get angry first. So one came, saw us, wrote something to go and buy a folder for them. I was paying, and I was buying stuff for their suturing or something. I was told that there is no receipt. If you want receipt, it's not available. But if you want to get the one without receipt, of course I agreed. I was still there when a policeman came and said, why didn't I report to police? Why would I? All this while the boy was furious, wanted to fight. I was still there when one of them woke up and said, he's a policeman, that why did I knock him down? he was drunk. That why did I knock him down? And the boy was saying, what do you mean? This is the man that helped you. So I said, can you not understand why everybody drives away? Do you understand?
Yeah.
Can you not understand? That is it. So in the health system, but everything we say is a problem, it's not justifiable because it's health, and we should be conscientious in the work that we do. We cannot use other people's mistakes to excuse the one of health.
Sure. I mean, I can understand that not every, medical practitioner out there can be as passionate as you are. But then I often wonder why we have to go through all these procedures when there's an emergency that is life-threatening.
Yes.
Why can't they just proceed to taking care of this person first before asking for police reports or asking you, do you have like
No, the government is sorting it.
Okay.
The National Health Act 2014 says don't ask for police report. Treat the person. But within 2 hours, inform the police.
Better.
That's which
Yeah.
is good, and it's being practiced now. The second thing is you want to pick the person. They'll come, either there is no bed and resources are not there. You want to take care of the person, there's no oxygen. There was a time some people came with a neonate to my hospital. They were rushing. They said they went to one hospital and they told them that there was no oxygen again. And so they came here. So I said, please, I have oxygen. And I gave them one tank, fixed it to the neonate in the night and said, go. And so I said, can we get your number? Go. So they went back and they were received. The man came back and said, you did not even take our number. What if you went away with your oxygen tank? Because when they went with the tank, they asked them, oh, why did you get it? They said, oh, so they received the baby. You understand?
Yes,
The,
sir.
the things to work with are not there. And oh my God, it's so frustrating. When you know that
Yes.
you can give an injection that can save somebody's life, it is not there. I had a friend who had accident in one of the states in Nigeria. I told him, okay, tell the nurse, I just want to know your blood pressure now, because he was agitated. He said that all the blood pressure machines were not working, for
Wow.
instance.
It's really
And that thing
sad.
exists everywhere. You don't need to go 2 kilometers from here before you see it live. So that's the frustration medical people find themselves in. They have to do it, using nothing. And they are frustrated, they are tired. And so, but I'm still saying there is still no excuse. If you are tired, don't leave the
Really?
profession.
True.
Then leave
Very
the
true. I
profession.
like the fact that you said it that way.
Yeah, but perhaps we should go one step further to hold those responsible to do the responsible thing.
All right.
Why is there no oxygen there? Why are the beds not adequate? Why are the staff not adequate? See, in this Japa time, if you were 10 doctors working in a unit, 6 can Japa. And then 1 can take excuse, 1 can be on leave, and 1 can be late. So 2 people. And they will continue to do the work of 10. Nobody will say, let's replace the 10. And so you really get exhausted.
True.
Okay? And when you get exhausted, mistakes you can make.
True.
We are talking about human beings here that have blood in them.
True.
That is why you
Humans
see
are
those
not
things
robots.
like
I
that.
always say that.
Sometimes go personally to those people who were found complicit and ask them, what was the situation that day with you?
True.
You will get it.
True. I think sometimes we even forget that the doctors are also
Humans.
humans and
Humans.
expect them to be superhuman.
Because we always blame them in situations like this.
Yes.
All right, doctor. But on a final note now, I just wanted to speak to Nigerians. What do you still think there are opportunities in this country to strengthen our health system? What are those opportunities you see on a final note?
Thank you for looking at the health system as a whole. We always think, or we all know that health system in Nigeria is not very strong. And to strengthen it, there are different dimensions.
Okay.
From policy to, from laws to policies, down to infrastructure and personnel, and maybe other factors like behavior change, both from the community and the health workers themselves. So it is the lot of all of us Nigerians to strengthen, if everybody does its own very well. If there was a budget to provide certain things in a hospital, now that we have freedom of information, let me start with you. Now that the journalists know that this was the budget and this was what was to be purchased, have they gone to check after a year or two whether that budget was implemented? Was the thing purchased? What was brought, was it working? That will be the role of the journalist, isn't it?
Yeah.
And then the role of the government will make sure that the thing is provided. And then the role of the medical practitioner is to make them conscientious that everybody will want to do his job very well. And we all have roles to play to strengthen the health system, because the health system is certainly not strong. If you ask the chief medical directors around, they will tell you that power alone takes almost all the money that they are allocated. Either they are buying diesel or paying electricity, because the I think everybody has migrated to band A, right? So they pay that to electricity. And then those people are not paid, they stop supplying them lights. So they have to buy diesel. And then the cost of diesel is not cheap. So they're really struggling to keep the place just going. So it is multifaceted. It is multifaceted, but it is possible. When you see a problem is difficult, start by the smallest achievable ones.
Thank you, Doctor. I think we have to allow you hold that. But we'll
Thank you.
always like to have you again.
Thank
This
you.
is how we call it a wrap on this edition of Idea Morning Digest. We've been speaking to Dr. Talemoda, who is a health advocate and has been doing something tremendous in the rural community. We applaud your work and we are with you. Thank you so much for coming.
Thank you.
Thank you
for
very
being
much.
on the show with
It's
us.
my pleasure.
All right.
All right.
Thank you.
So until we come your way next time, do not forget to follow us across all our social media platforms at Idea Television. Remember, our health is everybody's business. So do what you must do to ensure that people around you are healthy and safe. Have a good day. My name is Chinatu Oji and I've been with
Dear Restemba.
Together We See.
Bye.